Hello everyone. So today I am here to discuss the topic of the patient counseling. Here we will discuss what is patient counseling, what are the aims of the patient counseling, and what are the special cases, what are the steps involved for the patient counseling. So discuss one by one. Let's start with the patient counseling, why it is important in the hospitals. So patient counseling refers to the process of providing information. As the name mentions, patient counseling. So we are counseling the patients. Who we? Means the pharmacist. Of course, pharmacists are counseling the patients about the drug aspects, about their therapies, about their disease, knowing what actually patients know about their disease, what they are thinking. So every aspect regarding the therapy of the patient is taken in the patient counseling. It refers to the process of providing information. So pharmacist is providing information to the patient. They are advising the patient. They are assisting the patient to help patients to use their medication. Assisting means sometimes what happens, the patient is not able to take their drugs as actually they have to take. So means the administration, some of the formulation could be the IV, some of the formulation could be by any other mode the patient cannot take it. So in the administration, and sometimes what happens, there are some of the reasons called as a non-compliance. The patient is not able to take medicines, and there are many reasons. One could be the intentional or unintentional reasons. The patient forgets to take the medication. So at that time, the pharmacists are the key role in this. Pharmacists will tell how to increase the compliance. So in that way, they are assisting the patients. So this is about the patient counseling. Now, what are the aims of the patient counseling? What we want to achieve from it? Why it is important? What are the objectives here? So let's see. Point number one, better patient understanding. If pharmacist will tell each and everything about the therapy and what are the patient's query, of course the patient will get better. So better patient understanding of their illness, what patient is suffering, and role of medication in its treatment. So sometimes what happens, the patient don't know because the patient has a prescription and drug A, drug B, C, and many others are written. So what happens here, pharmacist will tell A is for this disease or this symptom, B is for treating this symptom, C is for this symptom, X, Y, Z could be. So what happens when now pharmacist will tell each and everything about the patient. Patient will get to know actually why each of the drugs is important. So another is the improved medication adherence. Of course, when the patient will get to know about the therapy and how therapy is important for the patient to improve the symptoms, to improve the disease, of course, there will be the improvement of medication adherence. Patient will take the medication as the patient should to take. More effective and drug treatment. So of course drug treatment will be effective there. Reduce incidence of medication errors. I told you when the pharmacist will see the prescription and will tell to the patient what happened, there will be the reduction of medication, reduction in the incidence of the medication errors, because the pharmacists are also the professionals, they are the drug experts. They know very much about the adverse drug reactions, adverse effects. Unnecessary healthcare cost will be reduced here, because when the medication errors are not there, when the adverse drug reactions are not there, of course the patient will not hospitalized again. The disease will be treated in a shorter duration. So these are some of the points. And last aim is the improved quality of life of the patient. Ultimately, when these points will be followed, the quality of the life of patient will be improved. Now, there are some of the, we call it as a communication skill for the counseling, which is required for the pharmacist. So, communication skills for effective counseling is mainly categorized as verbal communication and non-verbal communication. Not from the pharmacist's point of view, but for every type of communication, it is of two types. One is the verbal, another is the non-verbal communication. For the verbal communication means what we talk. So it covers up to 40% of the message which impact on the patient understanding. Whereas if we see for the non-verbal, so it is impacting more than the verbal. How much percentage? It's a 50%. So during any interaction, approximately 50% of the way a message is conveyed comes from the body language. So it's very important to take care of the non-verbal communication as well with a verbal communication. Now there's some of the points we can see for the verbal communication, and there's some of the points also for the non-verbal communication. Let us do first for the verbal communication. In the verbal communication, what is important is the language, how we are speaking. So speak the patient's own language. Try to speak in a language which patient used to understand. It could be Hindi, it could be English, or any other way. Sometimes what happens, the patient understand by the visual charts. So pharmacist should also try for the that language which the patient used to understand, which patient used to get more. So another is the tone. While speaking, as the language I told you, similarly tone is very important. So tone should be caring, tone should be should assure to the patient, should confident to the patient about the therapy. So it should be in a caring manner, it should be reassuring to the patient. There is another point that whatever you are speaking, what is the volume? So the volume should be either quiet, sometimes it requires quiet, so it is situational. Sometimes it is quiet, sometimes it is loud as required for particular condition. Similarly, speed is also very important for the verbal communication. So speed should be as we are if we are giving the relevant message, of course they are relevant because it's related with the drug therapy. So the relevant messages in the logical sequence. So whatever the information is given, the speed should be in a logical sequence. So in verbal communication, what we have discussed: language, tone, volume and speed. These four parameters are studied for the verbal communication. Another is the non-verbal communication. So if I talk about the body language, there are some of the points here. One is the proximity, means how a pharmacist, as this is the perspective from the pharmacist, so pharmacist is close to the patients in regarding with the space. So proximity is the first parameter studied under the non-verbal communication, and it is categorized under four. One is the intimate. Intimate means very close, means less than 45 centimeter. Another is personal. So personal means it is between 45 centimeter to 1.5 meter. Whereas third is the social. So social space means it is nearly 1.2 to 3.6 meters, as we see in the seminars, in the conferences, social gatherings. And public. In public means it is more than 3.6 meters. So this is about the space, the distance between the people. Another is for the body language. There also one of the things is the eye contact. So eye contact varies whosoever is speaking and whosoever is listening. So it varies while speaking to the listening or listening. It varies depending on at the time of speaking and the listening. Another is the facial expression. So facial expression should always give the empathy to the patient. As the patient, we are dealing with the patients, so they are suffering from the illness. It is very important to assure the patient, to confident the patient about the treatment. So these 3 points will be covered under the non-verbal communication: proximity, eye contact and facial expression. Another is we have discussed the communication skill, the parts of the communication skill, what are the parameters studied. Another is the steps involved in the patient counseling. Means when a pharmacist will do the patient counseling, will tell to the patient, so what are the basic steps the pharmacist should follow. Point number 1, preparing for the session. Okay. Point number 2, opening the session. Point number 3 is the counseling content, and point number 4 is the closing the session. So basically there are 4 points involved while doing the patient counseling. Whether preparing the session means, what is a pharmacist will do here, pharmacist should know as much as possible about the patient. Means pharmacist will ask about the patient's name, a pharmacist will greet to the patient, will ask about the information of patient disease, ask about the patient therapy. So this is called as a preparing for the session, and maintain the rapport between the patient. Another is opening the session. Once this type of information the pharmacist will get, pharmacist will introduce the session, which is called as opening the session. Here pharmacist will ask the question. What is the question here? Firstly, pharmacist will tell to the patient and explain purpose of the counseling, why the pharmacist is doing the counseling. So explain the purpose or objectives. Obtain drug related information means what drugs the patient is taking, what drugs patient had taken, is there any side effects, is there any adverse effects such as any allergy, any herbals the patient is taking. So these are some of the questions pharmacist will ask in the opening the session. Assess the patient understanding, and will assess the patient about what patient actually understand about the therapy or their treatment. Another is the counseling content. Once all of this data pharmacist will get, what pharmacist will do? Pharmacist will tell to the patient about the what are the drugs physician wrote on a prescription order. So pharmacist will see the names, will see the strength of the medication, and will tell to the patient why this drug is important, why this dose is important, what happens if this dose is missed. So the reason why it has been prescribed, it is very important to tell the patient, as when the patient will get to know, patient will adhere, patient will comply. So it is very important reasons why it has been prescribed, how it works, what is the mechanism. Mechanism in the sense I am saying a particular drug is working, drug A is working as an antihypertensive, so it will reduce the BP. It is very important to take. So in that way the pharmacist will tell how to administer. The drug is taken orally only. The drug should not be taken by any other route. So administration important. What is the storage condition? Many drugs deteriorate just because they are not placed properly. So storage condition is very important to tell. Expected duration, for how much duration a patient will take, especially for the antibiotics, whether resistance will happen just because the patient is not following the duration of the treatment. So expected duration, and what are the benefits, what a patient will see after completing the therapy. The patient will get rid of the disease condition, will get rid of the symptoms. So these points will be discussed in the counseling content. What are the adverse effects? If the patient feel after taking a particular medication such as sedation, such as any allergy, such as any skin rash or lowering of BP, anaphylactic reaction, these all things pharmacists can discuss to the patient so that they can aware of actually these effects are by any of the drug. And similarly, it is very important the pharmacist should tell to the patient about all of these things, and patient should report it to the pharmacist as a follow-up. There is a closing of session. After telling everything about the therapy, about the disease, it is very important that what pharmacist told to the patient, actually patient get it or not. So this is called as a closing the session. In closing the session, what pharmacist will take is the feedback. Means ask the question in a manner that actually patient had taken what pharmacist want to tell. So feedback and summarizes by emphasizing key points. This is in the closing the session. Now completing this this all about the patient counseling, the steps. There is another slide called as qualities of the good counselor. If I am talking about pharmacists are involved in the patient counseling, then how they should be, what are the quality they should have. So they should be a good listener. When they will get all the information from the patient, they try to understand it, they try to listen it. So they should be good listener. They should have the best technical knowledge about the drugs. That's why we're calling them as a drug experts. When they have knowledge, of course, then only they will tell about every aspects of the drug. It could be adverse drug reaction, interactions, precautions, contraindication, anything. They should be confident. When they will be confident, then only they can confident to the patients. They can assure to the patient, reassure to the patients about the therapy. They should be tolerant. They should not be temperamental. Yes? So they should be tolerant. They should not be judgmental. So judgmental about, we can say there are many options of the therapy. A particular disease is treated by drugs, a particular disease is treated by surgery, a particular disease can be treated by exercise or non-pharmacological measures as well. So they should not be judgmental for any of the types. They should be open for every strategies. So another is the empathetic. A pharmacist should assure to the patient about the therapy. So this we call it as a empathetic. Another is the flexible. Pharmacist should be flexible in nature. So these all points will be taken as the qualities of the good counselor. Another section is the special cases requiring pharmacists. Now what happens, besides the normal patients, there are some of the very special cases where pharmacists have to treat in a special manner. And what are these type of cases? We'll do one by one. See, these patients could be elderly patients. Means why they are special patients? See, special cases, because in aging, what happens, the learning process will impact. So when the pharmacist will tell to the elderly patient, it's very important to note that the learning process is impacted, their listening skills is impacted, their speaking is impacted, their vision could be impacted, hearing could be impacted. So we have to tell to patient in a manner so that these things, by avoiding these things, how we can tell to the elderly patients in a best manner. So what need to do is here, set reasonable short-term goals. Don't make the long-term goals, because these all things could be impacted. At that time, we can maintain the short-term goals. We can increase the follow-ups and break down learning tasks. We can use the visual charts. These 2 tablets taken for 5 days. Yes, we can mark on the tablets or capsules also. So these types of things can be done for the elderly patients. Learning tasks into smaller components. Encourage feedback. And just because the learning process is impacted, vision, speech, hearing, this step becomes very important. Encourage feedback. So to take feedback, whether they understand the intended message or not. Another special case is the terminally ill patients. Terminally ill patients, we can say these type of patients who are near to the death, suffering from very severe or chronic condition. So for these patients, what a pharmacist can do is the pharmacist should understand and be aware of own feelings about death. What they would feel if they are near to death. So they should be aware about their own feelings of death, and in that manner they can interact. Be simply honest. If they are honest, of course, the patient who they are counseling, called as a terminally ill patients, they can ask the queries. So simply being honest with them can improve their interaction with them. It will also open them up to voice, means they will ask the queries only when the pharmacist will honest to them. So this is the key point while dealing with the terminally ill patients. Another special case could be patient with AIDS. So, as this is a condition, we call it the chronic condition, where the therapy is for the longer duration. So, it's very important when we are dealing with the AIDS patient, as a pharmacist are dealing with the AIDS patient. So, patients with AIDS are not only dealing with a life-threatening disease. Of course, it is a life-threatening disease, but with that, it is a social stigma also. People are, actually the society are taking this disease as it could be spread by the touch, it could be spread by, it is a communicable. So, they have such a mindset. Just because of this, it is a social stigma also. So, for this, what pharmacists can do, due to the advent of highly effective antiretroviral therapy, research is going on for the antiretroviral therapies, and now there are many established highly effective antiretroviral therapy in the market. It is good to tell to the patient by the healthcare professionals as a pharmacist, and they tell to the patient so that they adjust their thinking to perceive HIV infection as a chronic condition. They will take HIV infection as chronic condition, not as a terminal illness. So, we have to assure to the patient when they will take the HIV therapy, as it is a highly retroviral therapy, they can be better. So, don't take it as a life-threatening disease. This is the main point for the while dealing patients with the AIDS. Another special case is for the mentally ill, the patients who are mentally disturbed or mentally compromised. So, patients who are mentally ill can be difficult to communicate with. Why? Because of course, maybe the learning process is impacted, their hearing, their understanding process is impacted. That's why it's difficult to communicate with. What we can do for the clinically ill patients, try to ask open-ended questions. Open-ended questions means which is not answerable as yes or no, where the patient, whosoever the pharmacist is communicating, answers in a manner where there is lot to write, lot to answer. So, means if I am just giving an example, like I have taken an question, do you have taken anti-diabetic drug? Maybe any mentally ill patient is suffering from the diabetes, and we have asked this question, do you have taken any anti-diabetic drug? So, answer could be yes or no. So, this is called as a closed-ended questions. There is the answer is like yes or no. Now, I am asking a question, question number 2. What drugs you have taken for diabetes? Patient will answer A, drug B, drug C. So, there are a lot of things the patient will tell. This is called as an open-ended question. Another example of the open-ended question is how you are feeling after taking a drug, okay? After taking a therapy. So, these type of question called as an open-ended question, and from these type of answers, when we will ask the open-ended question, the patient will answer in a manner where there is a lot of things. So, at that time, pharmacists will get to know more about the cognitive abilities, what patient actually remembers, patient actually understands. So, the cognitive abilities can be taken only by asking the open-ended questions. Now, mentally ill patients might not always understand their treatments and medication purpose. That's why it is a keynote taken when dealing with the mentally ill patients. Try to tell to their family members, their caregivers also, so that they can support. Another special cases we can see. Some of the special cases are point number 5. Patients receiving specific medications. So, specific medication means Medications which have narrow therapeutic window. Yes, means they can cause the toxicity if the dose will be increased over the therapeutic window. So at that time, it's good to monitor the drugs, monitor the patients, and there the concept comes as a therapeutic drug monitoring. In this, patient blood sample is taken after giving these type of drugs, means the warfarin, theophylline and methotrexate, these type of the examples from the narrow therapeutic window. When these drugs are given to the patient and patient is suffering from the chronic conditions also, at that time therapeutic drug monitoring is done. In this, the patient blood sample is taken after the hours of administration of warfarin, theophylline or methotrexate, and try to understand the dose level. On that basis, we are checking actually the required dose is present or not, or if any problem is there, try to assess it either by modifying the dose, so or by changing the drugs. So specific medication means for the narrow therapeutic window and also for the antibiotics. For the antibiotics, what happens? There is a resistance happens. So in that case, monitoring is required, patient counseling is required. For the complex medication regimens, means anti-tubercular drugs. These drugs are causing the resistance. Therefore, important to do the patient counseling. Then there is some of the drugs which require the specialized delivery. Patient not able to understand how to deliver the drug, how to administer for the inhalers and rotohalers. Another is the patient with a history of patient medication adherence. The patient who don't comply with the therapy. At that time, patient counseling is important. Try to understand why the patient is actually not taking. For the elderly patients who are taking many medications, means the patient is suffering from many of the disease. Patient discharged from the hospitals, of course, follow-up. As a follow-up, patient counseling is required. Patient referred by the physician, means from the primary to the secondary care, secondary to the tertiary care, generally complex cases which require assistance. So these are some of the special cases of patient counseling. I hope you all get about the patient counseling, what are the special cases of patient counseling and the steps involved in it. So thank you so much everyone. We'll meet in the next session.